Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Here we go. Okay, I have another joke. I have like a whole list. I've got like 300. So we could do a lot of podcast episodes because I have at least 300 jokes here. Yay. Did I ever tell you about that time I went mushroom foraging?
No.
It's a story with a morel at the end. A morel mushroom. Am I saying that wrong? A moral mushroom? Morels are mushrooms, right? Okay. Not everybody's watching the video. Some people are listening and he's just looking at me. He's like not saying anything. He's just looking at me. If you're on audio, you can't just go silent.
I can't.
No, you
How's
can't.
it spelled?
Morel.
Morel.
That's what I said.
I'm unaware.
Really?
Yeah.
I think they're the little fancy little mushrooms you get at like Auguste.
Is that like
The little morel mushrooms.
Oh, right.
I think. Maybe. I could be wrong. I don't know.
Okay.
Okay, well, that wasn't funny because you didn't know what I was talking about. It's morel. A story with morel. A story with a morale.
Oh.
Okay. Well, that was a fail. Let's hope the conversation goes better. So we had a patient who had really good results with his stem cell procedure. And so he was talking up a local chef, and I guess one of his relatives is the hostess, maybe. And they are both, based on the conversation, they sound like they are both prime candidates for, the stem cell procedure for joint pain specifically, in addition to probably the overall health optimization.
Oh, right.
And so to be accommodating as a favor to the referring patient, we offered to do a brief discovery call for free, that we don't normally do. And so I scheduled that with the woman who was the hostess and never did get through to the dude that's the chef. And so then like the next week or next day, I don't know how much time passed. She called back and she canceled her free discovery call because her primary care physician, probably with Oshner's, told her that she was not a candidate for regenerative medicine. So I personally think it is the height of ignorance to cancel an opportunity to get information.
First, let me just say something before you continue. I think we should start using the word nescient.
Nescient?
Yeah, it has maybe less visceral impact than the word ignorance.
Oh, well, I think you should use the word nescient, and I will continue using the word ignorant, because technically the word ignorant is a nice word coming from me. Are joint pain and stiffness slowing you down? At Infinite Health Integrative Medicine Center, we specialize in regenerative medicine therapies designed to actually repair and restore without surgery, without months of downtime, and without a lifetime of pain medications. Our patients are getting back to the activities they love: walking, running, even playing pickleball, pain-free. Ready to discover what's possible for you? Schedule your free discovery call today at yourinfinitehealth.com. That's yourinfinitehealth.com. At Infinite Health, we are redefining what aging means.
Okay.
Okay, anyway, so I wanted to get your thought on that reaction.
So the reaction of the physician or
Of the
patient?
primary care physician who has no clue about regenerative medicine and who is not a candidate.
Yeah, I guess from a physician standpoint, we're all bound to try and do the best for our patients and try and get the best outcomes. And trying to be open-minded and trying to put myself in that position somewhat. Uh, when we hear uh, when we hear about novel therapies or techniques um, or or those types of things being uh, tendered to patients, we don't know whether or not sometimes, and we're all very busy uh, and we're trying to prevent harm. Obviously, I think the issue there for the physician is, well, maybe I'm not aware of the information that the patient is being discussed with the patient, and so I can't advise for or against, but taking a generalized viewpoint that that the patient is not a candidate doesn't allow the patient to exercise their own intellect and review and trying to find an outcome that serves their vision of health. And the vision very often reactive physicians um, are prone to say, you shouldn't do that because in the offing that they don't want their patients to be harmed, but in their position of nescience, it's somewhat um, guarded on their part to try and say that because they're not in a position, and maybe it would be better for them to go ahead and say, "Well, I'm unaware of that information," and maybe assist them in trying to make the decision by informing themselves of what's being offered. From the position um, of the patient, it behooves us as patients to create an image of what we desire our health to be, because very often we get caught up in the failures we've had, and we defer to our physicians as our advocates to be making the best decision for us. But in that setting, if the outcome is not what we desire, then we become victims, and that's never a good position to be in. So um, it's key to empower ourselves to investigate and make choices that are helping us get to that endpoint that we desire. And if for example, if we're a diabetic and we want the best outcome for ourselves, we envision ourselves with a normal glucose metabolism, for example, instead of one that is compromised by whole body inflammation and inadequate hormone activity and not just inadequate insulin activity or insulin activity that's impaired by our body's physical status from other things. But if we put in our mind that we're going to take the image that we want a normal glucose metabolism, and our metabolism is normal, and we see that as our vision of outcome and excellent health related to our glucose metabolism, then really we drive ourselves by our lifestyle decisions, by the decisions we use, and it may include pharmaceuticals. But I've found over the last decade of doing integrative medicine that there are very few people that, by discipline and taking action on that vision of great health, um, that they can't obviate the need for medication. And that's been really an epiphany for me too. I've seen so many success stories that I can no longer enumerate them. So this is the thing that we need to do. We need to create an image for ourselves. We need to create that image that drives us to make decisions to achieve that image, not only consciously, but subconsciously, and then basically achieve that outcome. And many physicians are very nihilistic, seeing patient after patient after patient on a day-to-day basis, and they don't. They're not there to assist us in our medical mastermind to get those outcomes. They're there to get people through as quickly as possible. So their administrators are not telling them that they're not meeting their quotas. And I think I deviated a little bit there.
You did go,
yeah.
but okay, information rich.
Yeah.
So then the question I have is, what would have been a better response for that primary care physician?
So I'm unfamiliar with maybe he didn't have enough information either.
And that's my point.
Yeah.
A better response would be, I don't have this information. And if he wanted to go a bit above and beyond, he would have gotten your information and asked to speak to you and educated himself on who you are and what you do and blah, 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 blah. Like,
I have a fee for that.
well, maybe you do and maybe you should, but when and it's not even just doctors, like if you're communicating with, you're interacting with a lawyer or a CPA or anybody in a professional realm, and you approach them with something, what sets excellence apart from half-assery is the expert who says, I don't have that information. Let me look into it, or let me refer you to someone who has the information. And that's what separates a quality healthcare provider, a lawyer, CPA, plumber, I don't know, away from
empowered
subpar.
perspective. Empowered perspective. That's the law of empowered perspective.
Okay, don't go into that.
Awareness.
We're not
Mindfulness.
we're not going into that now, but we will, because I know you want to talk about it. All right, listener, hope you found this educational, informational, somewhat entertaining, and until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.